Our next guest today is Ashley Filiatru Spalding, who is the nurse practitioner. Is that how you
Yes.
do that? Say that, Ashley? With the nurse practitioner with Eva McDowell Clinic
Yes.
in Springfield. And we're delighted to have you here today, Ashley.
Thank you for having me.
I'm really glad that you could be here because this is Heart Month. And I wore my red today
You're red, yes.
for Heart Month because, you know, needless to say, that's a really important topic because I think that heart attacks or deaths from heart attacks are what, the number one maybe?
It's the most common cause of death, yes.
Yeah. So we need to be thinking about our heart health, and I'm glad that we have awareness about that. And I know that you had something in the newspaper about, you know, warning signs and also the kinds of things that we should be doing to take care of our heart.
Right. There's a lot of things that we can control as far as lifestyle to help with the heart health. There are some things we can't as far as genetics. So it makes it that much more important to do what we can to help decrease heart disease because that's where it starts. So things such as cholesterol, blood pressure, keeping those under control and seeing your primary care provider to make sure that things are looking okay.
I suppose that everyone still should have a checkup, a good physical once a year.
A good physical once a year. Some people are lucky enough to get to come more often. Just depends on what you have going on, but at least once a year, getting that fasting blood work to check cholesterol levels and to get that blood pressure check and to go over anything that, you know, maybe you might not think is a big deal, but your provider could pick up on.
Well, right. Of course, you don't know. I know my cholesterol last time I was at the doctor's office was a little high. So I think now that your cholesterol is required to be 200 or below to be in the normal range.
We look at it in a few different ways now. Total cholesterol, they recommend to be less than 200, but they actually break it down to where you have bad cholesterol and good cholesterol. So we look at your bad cholesterol, there's a certain level we want that under, and then we want your good cholesterol to actually be a little bit higher because we found that decreases risk of heart attack. And you can raise that HDL, your good cholesterol, with exercise. So those are two things we look at rather than just focusing on the total, because you might get credit for having some good in there too.
Yeah, yeah. I did. I had some good cholesterol.
Good.
and I don't know if this is, I mean, I don't know, but I also started taking some fish oil, and it really helped.
Right.
Now, I don't know if it helps everybody, but it did me.
And that's kind of what you have to realize is some things work for some people. Fish oil has shown to help with triglycerides, which are the more of the fatty acids in your blood. And there's other medications that focus more on the LDL cholesterol and the HDL cholesterol. So it's kind of like anything else. One thing works for one thing, and then sometimes you've got to add something else on. So
Right,
kind of
right.
staying on top of that.
Yeah, not everything works for everybody, and of course, I think you have to be particularly careful, don't you, if you have a genetic predisposition.
You really do. And when you look back and you look at grandparents, parents, and kind of see what they've gone through, it gives you a pretty good picture of what you could be facing. So hopefully as the years have gone on, we've learned a little bit better as to how to improve our health. And smoking is a huge issue. You know, I feel like possibly we don't have as many smokers as we used to as far as the younger ages that are coming up. But it's really big in the 40 to and up ages, and it's that's what people did. They smoked.
Yeah.
Um,
Yeah, when people my age, including myself, started smoking, we had no idea it was bad for you.
right.
Yeah.
It was kind of a pastime, and
Yeah.
everybody did it.
It was cool if you smoked.
Exactly.
It's not cool anymore,
Well,
Ashley.
20 years later, and you still have your smokers, and you work and you try to decrease risk factors as much as you can. But hopefully, the more we learn, the better it'll get.
And there's so many things now to help. Hopefully, you don't ever start smoking to begin with, because now everybody knows the risks involved.
Right.
But then if you have been a smoker, and I quit a long time ago, fortunately for me, because it is such an addicting habit.
Right.
But luckily, there are so many things now that you can get at the doctor's office. You know, the patch, I don't know what all they have now, and then they have those classes that you can take, hypnosis. There's just all kinds of things now.
Right,
aren't
there are, and it's good to be able to take advantage of those things. Like you said, they have the patches and the gum, which have kind of been around for a little while. There are a couple of different medications that have proven to be helpful, but it also boils down to you have to want to quit. So the resources are there, and we can encourage and be there to support. And then once you do get in your mind that you're ready to quit, then you've got something to go for. So
Yeah.
we can talk to her blue in the face and until somebody's ready. So you just kind of encourage and try not to patronize, because it has been an issue for so long. So you
Right.
just support.
Well, I know that smokers, if of course you can't hardly smoke in any public places anymore. So if you are somewhere and somebody's smoking, they're almost ostracized. They're looked at like, get that smoke out of here.
Right, it's true. And I think it's because it has, like you said, it's been taken out of public places, whereas before when you went to a restaurant, you expected to smell that. You didn't really pay attention. And now that it's gone and somebody lights up, it's pretty obvious.
Yeah.
And then we've also learned, the side effects from secondhand smoke. So it's kind of relearning and trying to figure out how to kind of best treat everybody, but then not make anybody feel bad about themselves either.
Right.
Because it's an
right.
addiction, just like
Oh, it certainly
anything
is.
else. So
That's for sure. Yeah. Well, I'm glad though. I do think that there are a lot of people quitting, and I know that if they began at all, and hopefully our younger generation is just going to not smoke at all. So.
right. The only thing, trying to convince a teenager, that's a little difficult. And it's not too difficult for a teenager to get a hold of cigarettes, and they're invincible still. I was there once.
Yeah.
So, the support of parents and trying to not just think, oh, it's just a cigarette, they're sneaking, it's not a big deal. That can turn into more. So trying to get the support from parents and making sure that their 15-year-old's not smoking or doing the best they can. It's hard.
Yes, I
Yeah.
know. Been there, done that.
I'm looking forward to it.
Think about that Ben Hayden.
Uh-oh, Ben.
Oh, I don't even want to talk about it. So, and then also, of course, like you say, the predisposition, if it runs in your family, and then smoking, and then, of course, exercise plays a big part, you said. And I know that's always difficult because, if you work full time and you've got families to take care of, it's just tough.
Right.
And but it's certainly something we have to be aware of all the time. And then I suppose your weight is involved in that.
It certainly is. As far as exercise goes, the recommendation is about 30 to 40 minutes, 4 to 5 times a week. And sometimes that is difficult, especially when you've got other people to take care of.
Yeah.
Usually
Like you, for example.
Usually you get put last, yes.
Yep, put yourself last, that's right.
But even starting out, most people don't need to start out exercising that much when they haven't been. Starting out 10 to 15 minutes a day, just getting your heart rate going and, getting a little sweaty is helpful. And it overall impacts, a lot of your lifestyle. And then as far as diet is concerned, eating more lean meats, chicken, fish, those kinds of things, trying to stay away from more of the fatty red meats, increasing whole grains as far as choosing that wheat bread versus the white bread, and then really loading up on fruits and vegetables, which can be difficult too because if you're buying fresh produce, it can get a little pricey. So kind of paying attention to that. And you also have to be careful with diet because a lot of things that are heart healthy aren't necessarily good if you have something else going on, such as diabetes. One of my favorite things is I'll have a diabetic patient come in and tell me they ate a bowl of Cheerios for breakfast because it's heart healthy. And I'm going, yeah, that's good for your heart, but your sugar is elevated. So you have to be careful, and that's another reason, to follow up with your primary provider so you know exactly what needs to be done rather than just going with it because it says it's good for you.
Right, right. Well, you know what, I do some on with regard to fruits and vegetables. I mean, of course, the buying the fresh is I suppose the best, but when you lead such an active lifestyle, you don't want those things to go to waste, particularly when you paid that price.
Right.
But I suppose the next best alternative to that is frozen, because you can get frozen blueberries and strawberries and different things like that, and frozen vegetables.
Right. The steamers are really helpful.
Yeah.
You just have to watch with a lot of frozen foods and the canned foods as well, watching the sodium content, because then we start worrying about salt. You eat too much salt, and then your blood pressure goes up, and it's such a balancing act. So I try to stress that most anything is okay in moderation. That's the key. And sometimes we as humans aren't real great with portion control or moderation. If something's good, we're gonna eat it.
Yeah.
So, but it is definitely a more, it's a less expensive alternative. You just have to kind of read
The
those
sodium.
labels and keep an eye out because you don't want to overdo it.
Right. Yeah, because I suppose we get enough sodium in our foods, and I'll get something and then I want to add salt, and of course you don't really need to do that because there's probably already salt in it as it is.
Right, exactly. Try to leave the table salt alone.
Right.
And it's hard to do.
Yeah.
Because a lot of times the way they use that preservative as, the salt as preservative, it still tastes like it needs some more. So.
Yeah. So stay away from that salt.
Well,
And then, and I guess too now I think we're lucky in that, of course, with blood pressure, oftentimes you don't even know you have high blood pressure.
Right.
And so in addition to seeing your doctor, now you can just go into the drugstore or to a lot of different stores where they have pharmacies and get your blood pressure tested there.
Right, exactly.
In between.
Right, and that's helpful. The cuffs that you can purchase, they're not terribly expensive, and they're kind of a good investment to have around the house. You can get one at the pharmacy for about $30. I typically don't recommend the wrist cuffs if that's the best you can do. If you need a reason, if you have a reason why that's what you need or what you can only use. They don't seem to be as accurate, and they give us really high readings. So, and then the other thing I encourage people to do, if you do get your own monitor, take that with you to the doctor so you can compare what your monitor gets to what we're getting in the office, so you know how accurate your cuff actually is. Sometimes they're not completely accurate.
Okay, well that's good to know. Yeah, so I won't get nervous because when I see that my blood pressure looks high.
Exactly.
And then it's going to go up more because I'm nervous.
It's true. And people come into the office and there really is such thing as white coat hypertension. Just walking through the door and immediately their blood pressure goes up. So we try to help out with that too.
Yeah. So what should you look for, Ashley, as far as warning signs and things if something is wrong with your heart?
Typically, if you have heart disease that's causing a blockage in the arteries, you'll start to notice symptoms with activity when you're up doing something and you're getting more short of breath than normal, or you are having some pressure in your chest or pain in your arm. That's how it typically gives you a warning sign that something's just not right. And basically that artery isn't able to get blood to the heart as easily because there's plaque in there. And when you require more energy and more oxygen, more blood flow, it's not able to get it there like it needs to. So when you're exerting yourself, you start having those symptoms. It becomes more serious when you're sitting watching TV and you start having those symptoms, because that means that the blockage could have gotten worse. So at any time, if you have an increased shortness of breath, or you have the chest pressure, the jaw pain, the left arm pain, those are things to get checked out, and not to wait or think that it's going to get better, because sometimes you don't have that time.
Get right, call 911 and
call 911 if the symptoms are severe, not going away. You have that ominous feeling that something's just not right. A lot of people go thinking that they're having a heart attack when it's heartburn, because they say that the symptoms are very similar. But better to go by ambulance and get diagnosed with heartburn than to ignore that. And just once again, as humans, we naturally think something's going to get better. Think it's going to be okay. I'm going to be fine because I've got something I've got to go do right now. So, and then making sure you're getting that check and telling your doctor, your nurse practitioner, physician's assistant, whoever you see, of any of the symptoms that you're having intermittently with activity. But that's kind of your warning sign.
Should you take an aspirin if something like that happens, Ashley? I've read that. I think that
it varies from patient to patient how effective the aspirin is or who should take it. That's definitely something to discuss with your doctor when you go. I read something that if you feel like you're having symptoms that you should take an aspirin, then that should make you think I should call 911 because something's not right. You shouldn't think I'm going to take an aspirin to fix this. You should think,
right,
I think I need an aspirin, so I better call 911.
Yeah.
So, but it kind of varies from person to person whether or not you need an aspirin daily. So that's something to bring up with your primary provider to see if you'd benefit from that.
I think I saw that or read something like, to keep aspirin. Of course, as you get older, Ashley, you think about these things.
Right.
So, so I keep aspirin by the bedside table, in the car.
It's there.
In my purse. I read something that you should have aspirin, in case you thought you were having a heart attack or something, you could take that, call 911 and take that.
Right.
But that, it could possibly help save your life.
Right. It's good to have it. I would, like you said, the big thing is calling 911 and knowing that it's not going to fix it per se.
Yeah. And so now, Ashley, you are the nurse practitioner at Ephraim McDowell Clinic here, and you're a resident of this community of Washington County, and are from Washington County, from the Burg.
The Burg, yes, ma'am.
And it's just great to see that you are staying here in your community and practicing medicine here. And I feel fortunate that we have you here.
I'm glad to be here.
And then, of course, your husband, Brian Spalding, is from Washington County.
Yes, ma'am.
As well, and he is with State Farm here, and now you all have your second child.
Second child. Andrew is 3 months old, almost, and Amelia is our 3-year-old. So it's been a busy house.
I guess
it's been a busy house. Not too much sleep. That's not good for your heart either.
Yeah, I was going to say that's another part of having a healthy heart is getting your rest. And I think they recommend 8 hours of sleep these days, if possible.
Right. It needs to be good sleep. One of the big things that we look at now, the horrible snoring, or starting to, if you hear that you're waking up in the middle of the night because you're not breathing, or you notice someone that's stopping to breathe, you've got to worry about sleep apnea. And they're finding that that's contributing to heart disease as well. So,
wow. So you need to be tested for that.
Right.
You know, yeah.
It's just, it's making sure that, checking everything that you can, and trying to make sure that your lifestyles are as best as they can be.
Well, and now we're fortunate, I think, that we have insurance, you know, expanded insurance. So most people, the majority of our population, should be able to get to the doctor.
Right.
Or I guess the health department, if they don't have insurance. But I think the majority of our population does now.
Right. Yeah, we definitely see less and less people without insurance, which sounds like could get interesting. And we've seen the benefits of that. It has saturated our offices a little more, I believe, because you have people that haven't had health care for so long, and 10 years later, they're like, okay, I've got health insurance, and you start basically from head to toe on anything that's happened in the last 10 years. So trying to kind of prioritize and see what you need to address first. So the big thing people can do overall is improve those lifestyles earlier so they have less problems later. But yeah, having better access to health care has helped for sure.
Right, right. And now also in your office is at the Ephraim McDowell Clinic is who? Who all do you have there?
I'm the primary provider. I'm there 5 days a week and do family practice. We have Dr. Cole, who is a cardiologist. He comes once a month to the office. There are several cardiologists in Danville, and they actually do interventions there. So if you need a heart cath and you need a stent placed, they can do that in Danville, which is something that's the closest to our area
facility,
that you can have that
yeah.
done. You don't actually have to go to Lexington or Louisville.
Yeah.
So that's nice. And our cardiologists do a really great job, and they're available whenever. I know that they're usually on site if they have an emergency coming in. So that's helpful. But Dr. Cole sees patients once a month at our office, so that helps, so people don't have to travel to Danville, which isn't as bad of a drive as it used to be.
Right, with the new road.
Right, you know, you're talking 30 minutes to Danville, which is about the same distance to Bardstown, and it did not used to be that way.
Right.
So that's helpful too.
And Ephraim McDowell's gotten really big in their heart field now.
They really have, and the
Yeah.
things that they can do there, it's nice to be able to keep patients closer to home and to feel confident that they're going to get good care.
Yeah, yeah.
So,
And then is there anyone else that you have in your office?
Melinda Matherly is a dermatology PA. She works with Dr. Sloan, and she comes to our office twice a month. She's
Oh, that's good.
yeah, she's great.
I forgot about, and they, yeah, that's the dermatologist that, okay.
Yes, she does.
So you can get your skin checked, and or if you have any moles you're worried about, or
Exactly.
I guess I don't know,
She
lots
does
of
a
things.
lot. Or rash, she's the first person I call. So that helps tremendously. Because it's amazing the little things you can have go on with your skin. And typically, you know, as a primary provider, you look at it and you think, well, it kind of looks like that. But Melinda can do much more of an in-depth evaluation to kind of pinpoint what's going on. So it's
Yeah.
just like any other organ system you've got.
Yeah, yeah.
But those are the two specialists that we have that come to the office currently.
Uh-huh. And then you have other nurses in the office as well, or
Yes. Our office manager and my nurse is Marion Mann. Then our lab tech, so we draw labs on site as well.
oh, that's good.
And
yeah.
then is Angie Cameron, and she's also an LPN, so that's helpful because she can kind of do dual duty. And then Catherine Boone works up front in the front office, and then Teresa Hall does as well.
Great. Well, you got a
So
pretty
we're
big
well
staff
taken
there.
care of.
Yes,
Yeah,
indeed.
they take care of.
Uh-huh. Yeah.
Yeah.
And can they do X-rays or things like that, or say you come in and you are having chest? Can you get an EKG there?
Yes, if you come in and you're telling us that you're having chest pain, we're gonna get you back and call 911 for you. Make sure you're stable, and there's a few different interventions that we can do. But if you come in complaining of chest pain, more than likely we're calling a ride for you.
Yeah, yeah.
Yeah.
Well, we just want to decrease the number of heart attacks and the number of deaths from heart attacks. And so is there anything else, Ashley, that we haven't covered that we need to mention to the public?
I think we've done a pretty good job, Lisa. We've talked about smoking, and we've talked about cholesterol, and we've talked about exercise and diet. Knowing your family history does help.
High blood pressure.
High blood pressure.
One thing,
Uh-oh.
stress.
You know,
Isn't that a huge factor?
It definitely can be, for sure. And overall stress just puts havoc on your body. And whether that raises your blood pressure that causes issues, or perhaps it causes you to eat more so you're more overweight, or you don't have time to go exercise. I mean, that's a big thing. And your mental health is just as important as your physical health. It all goes together.
Right.
So,
right.
Yeah, making sure.
And I think that and our medical field, I think that has recognized that more in the last few years, and so now we can, now we're looking at classes that people give in, meditation, or learning how to relax, or to have less stress in your life.
Right.
And or maybe organize better. And
I can do that one, yeah.
yeah, I was thinking that also.
Uh-huh.
Yeah, and so because yes, that emotional, mental health, and that stress level certainly do contribute to the stress on your body, and contributes to the stress on your heart.
Right.
So yeah, because I'm a firm believer that we always need to try to be working on those things.
Exactly. Slow down.
Yeah, slow down and smell the roses.
That's right.
Yeah. So Ashley, I really appreciate you being here today. I think I've learned a lot, and I hope everyone else with Channel 6 in the viewing area has learned some good ideas and ways to help keep them heart healthy.